Hello, everyone. Welcome to the third presentation in the Water Resource Institute's Water Connect seminar series. During the seminar series, we are looking to focus on flood-related research by UVM faculty and flood experiences in communities. My name is Heather Clark, and I'm a senior youth science student here at the University of Vermont. I'm very excited to introduce today's talk by Dana Rowangould with the College of Engineering and Mathematical Sciences, entitled Flood Resilience and Equitable Recovery in Vermont, Mobility, Housing, and Community Connection. Dana Rowangould is an assistant professor in the Department of Civil and Environmental Engineering at the University of Vermont. Drawing from the fields of engineering, economics, and the social sciences, Dr. Rowangould's research includes rural travel behavior, transportation, equity, and justice, transportation and land use planning, energy use and air quality, and multi-modal transportation. Her work is motivated by a desire to improve transportation systems so they better serve people, particularly those whose ability to travel is constrained by their individual needs and transportation options. This talk will be about 30 minutes with 15 minutes of Q&A at the end. Please hold your questions until the end. Welcome to our remote guests. If you're joining us via Zoom, you can enter your questions into the chat box anytime during the presentation. I'll now turn the floor over to Dana.
Thank you all for joining. As Heather mentioned, I'm Dana Rowangould. I'm an assistant professor in civil and environmental engineering. I do want to acknowledge the full team that worked on this project. Sarah Grajdura listed first in the project itself. She led it, is not here because she's at Utah State now. Julia is joining us. Thanks, Julia. And then Nat Rauptoy is a student, HCAL student who also worked on this project. So I'm going to talk about flood resilience, and I'm an engineer. And I think that if you think of how an engineer thinks of flood resilience, you'll be surprised by what I'm talking about. So I want to give a little context about why I talk about it the way that I talk about it, which is that I'm really, within civil engineering, I'm a transportation researcher. And in transportation research, it's really important to understand how people use systems. So often we're focused on infrastructure design and the sort of structures underneath them, but we're also focused on where you put things and how people use them and how to do that effectively. And in order to do that, you really do have to understand how people are thinking about them and using them and sort of non-infrastructure outcomes. So I'm interested in equity and sustainability in the transportation world. And in order to work on that, I really do have to think about both the infrastructure itself and also the people that use it. So I'm in civil engineering here, but my degrees are in different disciplines. So my undergraduate degree is in civil and environmental engineering, so I have some understanding of infrastructure, but my graduate work is actually all in economics and policy. So I really am thinking more about the human side of the equation and how people make choices and how we can sort of adjust the system to lead to better outcomes for those people. So that's the perspective that you'll hear today, even though I'm in civil engineering. So I am a transportation researcher, but I had some reasons to do a flood resilience study. So as everyone knows, in July 2023, there was a big flood that inundated a lot of communities across Vermont. I had actually been working with some folks in my research group on mobility in a lot of rural communities that were impacted by the flood in that event. So we had just wrapped up a study where we had done a lot of interviews with people that had limited mobility options, so limited access to a vehicle. We've been working with some community-based organizations to sort of connect with those people and better understand their needs. And one of our big findings in that study was that a lot of people's situation was actually quite precarious. So, missing an inspection, an inspection that went wrong could really knock the wind out of them.
Let me just
affect their livelihood. It could affect all sorts of other things in their lives. So when the flood happened, and we sort of watched that happen in those same communities, we were immediately thinking about that precarity and how you think about people can get back on their feet and what we can do to think about those things. The other piece of this is that I mentioned Sarah Grajdura, who's in Utah. She was a postdoc in my research group, and her dissertation research was on evacuation from no-notice wildfires in California. So she already came with this disaster background. So between the two of us, we just thought, well, this would be a missed opportunity if we didn't try to take a look at it. So Sarah sort of brought the disaster perspective and knowledge that disasters can have really long-term impacts on marginalized populations. And in particular in rural communities, it can be really difficult to sort of break out of a cycle of poverty in the wake of a disaster. And then again, we saw more flood events. So part of the motivation too is that we know that climate change is happening, and we know that floods in Vermont and other places are getting more severe and they're getting more frequent. So it's really important to understand what we can do to sort of help people, not just infrastructure, get back on their feet. So our main objective was to think about how we build flood resilience from the human side. So what measures can communities and individuals, policies and programs take to increase flood resilience for the people that are most vulnerable? So we were interested specifically in short-term impacts, long-term impacts, and particularly in long-term recovery. So how, when you are in some precarious situation and you get perturbed, what does it take to get you back where you started or better? And we weren't just interested in mobility. Floods don't just affect how people get around. In the mobility study, we weren't just interested in mobility either, because it's all interrelated. So we were thinking about quality of life, economic well-being, health, mobility, of course, and housing. And then we were just trying to figure out a way to identify the types of factors that could help someone recover and that could lead to more resilience. Another piece of this was that we're sort of thinking about these repeated floods and in the long term what that means from the land use side. So in transportation, we're often focused on the land use side of the equation. So part of this conversation is inevitably going to be about relocation, for better or worse. And there are a lot of drawbacks that come with relocation, a lot of challenges. So we wanted to just learn more about what people were thinking about relocation. Do people want to and they find that they can't? Are they being forced to and they don't want to? Sort of what's going on for people as they're experiencing. Initially it was just that first flood, but then over the course of the study, it became multiple floods. So this is a high-level timeline. The flood happened, the initial flood that got us started thinking about it happened in July. 2 more flood events happened in the same communities in the time between then and now. So initially, we started to meet with some stakeholders. So some of the folks that we'd already been talking to for our mobility work, and then we added additional stakeholders that are working directly with people affected by the flood. So this was, community-based organizations that were on the ground, knocking on doors, mucking people out. It was state agencies that are providing a lot of the social services to people on the ground. We talked to FEMA, a lot of people at FEMA. So it was a whole assortment of, I guess there were 26 organizations, because we had kind of one call with each organization. 13 community-based organizations, 13 local, state, and federal agencies. And we were just sort of talking to them about what we wanted to do, hearing what they were saying was happening on the ground, letting them kind of tell us what they thought the research needs were, and using that to shape the study before we put the study out. We also provided a draft survey to those folks by email and got their feedback on it. And many of those partners really helped us recruit people to fill out the survey and to complete the survey. So we collected data, as Julie knows. Day 2 of data collection, Julie and Sarah got stranded because it flooded. They were like knocking on doors as people were preparing for the December flood, and so they got out of there. So we added a question to the survey about the December flood to try to get at some of this repeated flooding, unfortunately, which happened during our study. The data collection went through April. And then just in September, we had another meeting with our community advisors as a larger group to discuss our preliminary results. So today I'm going to share kind of like very first cut of results. I think the data set is actually pretty good. We're going to be able to do a lot of different analysis with it, but we wanted to come back to the stakeholders, show us what we saw so far, show them what we saw so far, and think about how we prioritize the next steps of the analysis. So I'm going to present a lot of those findings today. So the study design and data collection. So initially the work that I was doing on the mobility study was in Northeast Kingdom in Orleans, Caledonia, and Essex counties. They were again hit. Washington and Lamoille counties were also pretty hard hit, so we sort of added them to our study focus. We didn't exclude people from other parts of the state, and in fact, many of the surveys ended up in other parts of the state, but our focus was really on northern Vermont. Part of the reason for expanding the boundary too was that some of the things we were hearing from our community partners was that there was variation in the experiences in more dispersed rural contexts versus like Montpelier, which was getting a lot of attention and sort of an immediate recovery effort. Some of that variation in the study. Part of our goal was to make sure that we reached people with limited resources and people that had that were disadvantaged. So, we were looking for households in poverty as well-resourced households, so we could have some comparisons. The partnerships with community organizations helped us actually do that. We were looking for renters, homeowners, and the unhoused. To collect the data, there were sort of two main data collection efforts. There was an in-person and phone effort where we reached 50 people. And this was primarily targeting low-resource households, but also just knocking on doors on streets that we knew had flooded and just trying to connect with people at events where flooding was addressed. Everyone who participated got $20. The benefit of this in-person outreach, so we also did an online survey that I'll talk about in a moment, but the benefit of the in-person outreach was that targeted outreach, showing up at places where people were receiving social services, for example, but also that it was more open-ended. So, it wasn't just a tick the box survey. The survey did have open-ended questions that you could write in, but when you're conversing with someone and you can sort of ask an open-ended question and let them talk. So it was almost a hybrid of a semi-structured interview and a survey, I would say. And we were intending initially to do semi-structured interviews and then a survey, but timing-wise, we just decided to merge them and do it all at once because we didn't want recall to get, we didn't want to be too far from the event. And then after we did a handful of those in person, we sort of refined the survey a little bit, the questions to make sure they made sense, sent it out more broadly online, and continued to do that in-person outreach to keep collecting some of that qualitative data. So the wider distribution reached 180 people. We used a raffle for that part, and a lot of that outreach happened through our community partners. There were also front porch forum ads in a few in the counties that we targeted, and then some, the flyer and door-to-door had QR codes and things like that. The survey topics that we asked about. So as I mentioned, we're interested in short-term, long-term impacts and in recovery. So we asked people about different time periods. This can be tricky on a survey because people don't always remember, but with a big event like a flood, people often do have a memory of, I did the same thing with a survey post-pandemic. People have a memory of these kind of specific big events. So we asked them about what their life was like before the flood, during the flood itself, in the short term after the flood, and in the long term, which was a today question, which ranged from December to April. Mostly that was January to March. And then the types of questions we asked about their household, so the impacts that they had experienced on their home, on their vehicle, where they lived, if they were a renter or an owner, the location, if they had access to a vehicle, sociodemographics, of course, and then we asked about their resources. We also asked about assistance. So what help did you need? What help did you receive? What organizations helped you? Who do you trust in terms of those organizations? And then we also asked some Likert style questions about their outcomes. So quality of life, food access, health, safety, mobility, and economic stability. We always like to look at who we reached so that we know if it was just the friends of one organization or something, which would be more limited generalizability. So this map shows the share of our survey responses in each town in Vermont next to the individual FEMA claims. So we don't expect our survey to be representative of Vermont, but we're hoping that it's somewhat representative of where the flood impacts happened. So that's why the FEMA claims is shown next to this. As I mentioned, we targeted that area in gold in northern Vermont. A few communities really stand out as having high response rates. So in the inset at the bottom there, you can see Montpelier and Barrie kind of light up. They also light up in the claims data. That's where the impacts happened. So that's not surprising that we reached a lot of people in those places. And then you can see that even though we sort of targeted northern Vermont, some of our partners were working across the state, and our survey reached some other folks around the state. We also like to look at the demographics of who we reached. So generally speaking, pretty good range in terms of income, which helps us look at variation. We don't have something to compare this to. We don't know the demographics of the people impacted by the flood. So we can see that we have variation. So variation in income, age, gender, race and ethnicity, education. And then one thing that we did see too was that we had a reasonable number of unhoused respondents. So we had about, I want to say 24 people who were unhoused before the flood and 22 who became unhoused during the flood. And by unhoused, I mean they were living in a vehicle or outside or in a shelter. So we're counting shelters as unhoused. So we did do some specific analysis just of the unhoused population that we reached. Because they have particular types. feel free to ask questions if you have any. We can wait. Maybe we'll wait till the end. All right. So as I said, I'm going to talk about some of our preliminary results. One of the first things we looked at was mobility, partly because that's where we were coming from with this, also because we had funding for a student over the summer to look at mobility. So that's kind of how this works. But it is something that was interesting, and we got to set it up, and then we can use it to find other outcomes that we're interested in. So I mentioned we looked at several outcomes. This is all the outcomes, just like a high-level view of what happened over the course of this. So on the far left is before the flood. And the taller you are on the scale, the worse off you are. Okay, so during the
that may work for
more people reporting unstable income, more people reporting not in good health, more people who felt unstable life, lack of quality of life.
Or if you'd like to be removed from the waitlist,
and then the long term after the flood, which is basically that January to March period, many people have recovered to where they were before. Some people haven't. So that's that question of recovery we're really interested in sort of digging into in this study. So as a first step, we were just going to look at one of these, which is this inadequate mobility. So you can see it's like the rest, like many of the rest, not all, where it gets worse initially, recovers, but not fully. So we can dig in a little bit to who is experiencing those different mobility outcomes. And I've just kind of broken these up by a few categories. So one is vehicle access. When we look at the short term and the long term, people whose vehicle was damaged during the July flood had worst mobility outcomes. That's not surprising. If your vehicle's damaged and you're in a car-dependent place, you're pretty much out of luck. People that still had inadequate vehicle access in the long term still had poor mobility outcomes in the long term. Again, not surprising. Oh, I should mention, this is all, behind these check marks are chi-square tests of independence. So instead of putting the statistical tables up here, I'm just putting check marks, but these are statistically significant differences. The next category where we saw some relationships was in terms of housing. So renters and people in unstable housing were worse off in the short and long term. And this is all relative to where they were before the flood, right? So we look at where they are before the flood and if they're worse off. People who became unhoused were worse off in the short and long term, and people who were displaced in the long term were also worse off in the long term in terms of their mobility outcomes. The last thing we looked at was home damage from the December flood. And there we see, not surprisingly, that people's long-term mobility is worse and their recovery relative to how much of an impact they had. So like how much they bounced back. That's also worse if they were damaged in December. So that's not surprising either. It's like one hit after the other. So in order to be in the study, there were filter questions. They had to have experienced the floods in July. So these people experienced it twice. So that was kind of, I should say, maybe I'll say, I really wanted to do some multivariate analysis of that recovery variable. We really wanted to do a controlled statistical analysis where we could isolate the different factors that would lead to someone recovering. But unfortunately, when we get to that recovery variable, the sample gets much smaller because of the way that data is set up, and we couldn't do a multivariate analysis. So I won't show one here. We did a few that are not showable because we just didn't have the data for it. I'm hoping we'll be able to do that with some of the other outcomes though in the future. Okay, so the next question we looked at was how are people receiving aid? What kinds of barriers are they facing to receiving aid? And this is generally not just related to mobility, so all sorts of aid. So I'm going to show this graph. It's going to build a little bit. It's basically going to show us what help they said they needed and what help they said they received for different types of help. So the first example is going to be for repairs. In our sample, between 50 and 60% of people said they needed help with repairs in the short term. About 40% of people said they received help with repairs in the short term. So I'm going to show this on this graph with this little bar that shows you the gap in the help that they needed versus the help that they received. So it's up here because the need was high, and then the gap is this size because that's how much they didn't get the help they needed. Okay, we'll do the same for long term. So for repairs, people had certain short-term and long-term needs. They had a short-term gap. And then the same is true in the long term. They had long-term needs. They got some help in the long term, but there was still a gap. So we see in the example of repairs, we see that the gap basically persisted. It didn't get better over time. It stayed about the same size. We can look at a lot of different factors here. So we asked people about mucking out. Sarah went and actually helped people muck out. It's pretty labor-intensive work. We asked people if they needed cash. housing and shelter, food and supplies, filling out the aid applications themselves, mental health care, transportation, and healthcare. A few of these kind of stand out to me, mostly because they're sort of persisting in the long term. So the repairs, that gap persisted in the long term. Cash, the need got even bigger and was not filled in the long term. Filling out applications was still around in the long term. And then the mental health care, the gap was quite large in the short term and persisted into the long term. And one of the reasons I'm highlighting that one is because that's also one we heard a lot about in the open-ended part of the surveys. The other thing we asked people was who helped you the most. So we're interested in the types of organizations, and this partly came from our conversations with community organizations and hearing about organizations that were not flood response organizations at all, that quickly overnight became flood response organizations because they were the people who had the relationships and had the social infrastructure to respond quickly. So we were interested in that kind of dimension of this. We also heard people talking about, different interactions they had with state agencies and with FEMA and local governments. So we wanted to ask some questions about it. So neighbors and friends and family come out kind of on top when you ask people who helped you the most. That's not surprising. Federal agencies show up pretty high in the short term. Community and religious organizations also show up pretty high. And then, local and state agencies also have an important role for many people. We can also compare those responses for the unhoused. And I think what I want to highlight here is that the federal agencies really dropped for the unhoused. So the federal agencies were one of the top of the list for the full study, but when you ask just the unhoused people, they were lower on the list in terms of the organizations helping them. That's partly because the community-based organizations, the religious organizations were providing a lot of help. And I think it's partly the nature of the type of help that FEMA offers and who's eligible for that help. We also ask people who you trust. One of the issues that our stakeholders brought up in early conversations was that a lot of people, there's this idea that people will help themselves and they don't want to accept help from other people. And part of that, is about this kind of rural independence and this, relying on yourself. But part of it, I think, was also trust and relationships with outsiders. So it came up a lot with these conversations about FEMA. So not surprisingly, FEMA was at the bottom of this list. Neighbors, friends, and family are at the top. Community organizations were also high up on the list in terms of entities that people trust. And those were the people that we were hearing about kind of on the ground, knocking on doors, right when the flood happened and kind of sticking around and helping people through it. We also looked at the qualitative responses to find out more about people's barriers to accessing aid. So we can't ask everything on a quantitative survey because it becomes too long, but in those semi-structured conversations, we get to hear a lot more. So a lot of people talked about different information barriers, knowledge of the flood risk where they lived, finding out what aid was available and how to access it. The paperwork is quite complicated. There's many different types of aid and the requirements are complicated. And then the ability to get local news updates. Some people talked about organizations that would come and offer help and then didn't come back. So I think there were organizations that came to Vermont to provide help and had a certain amount of time and then kind of didn't finish the jobs they signed up for. So that was something people talked about. Repairs just take a long time, so not surprising there. Sometimes accessing aid was hindered by flooded roads or not having a car. So from a transportation perspective, we're not surprised to hear that either. You have to get somewhere to get your aid. I mentioned the sort of knowledge of how to access aid, but also just even with the knowledge, the application process is time-consuming, confusing. People get rejected, they have to reapply, they have to have the persistence and knowledge to know how to do that. They have to know what programs they are eligible for, and it can just be very difficult. And then the last barrier that some people mentioned was sort of mental health barriers. So a lot of people talked about, so here's a quote from one of our respondents who said that the PTSD is still a part of my life, but right now I cannot afford any counseling or therapy. For about 2 weeks, I was crying uncontrollably in public. I still have breakdowns for almost no reason. So some of the folks that we talked to were basically saying, the mental health challenge that I experienced with the flood made it hard for me to go out and ask for help. We also looked specifically at the challenges faced by the unhoused people that we spoke to. One thing that came up was that many of the people who were unhoused before the flood, in fact, the vast majority of the people who were unhoused before the flood were living on rivers. You know, you think about Vermont towns and where there's open space that's near services, and it's basically the river corridor. So they were among the first to flood, and when they did flood, all their belongings were washed away, and it happened very quickly. So here's a quote from one of our respondents who says, "All my stuff was lost. I'm never getting that back. I lost my birth certificate, everything I needed. My mom's will was in there, my whole way of life, my pay stubs to get myself into another apartment. Everything they would ask me for to get an apartment, you know, I lost it all. The water destroyed everything." So you can see how this illustrates the sort of the difficulty if someone is sort of knocked down, how hard it is to get back up from that type of loss. Some of the unhoused respondents also talked about how they experienced differential treatment. So the people who needed less help were getting more help. Some talked about how there wasn't enough room in the shelters, or there wasn't enough access to affordable housing. So when you lose a lot of your housing stock and you already have a housing problem, that really makes it difficult to go find affordable housing in your community. And then some folks talked about how they didn't have a phone or access to the internet, which is really instrumental for accessing aid, just being able to communicate in that way. So we brought all these findings to the stakeholder groups, as I mentioned, and we sort of shared our findings and talked with them. A lot of them had, you know, real world insights about a lot of these findings, and had a lot of insight about what the programs are that people are using because they're implementing those programs. And so we talked about potential recommendations. So one thing that came up, there was a woman on our advisory group who's making the state's hazard mitigation plan, and she was really interested in this finding that the unhoused people are living along rivers, because she was saying, you know, that's something we can try to react to, right? We can try to go to the rivers and help people evacuate and notify them that a flood is coming in the space before the flood happens. We also talked about how there was a need to kind of invest in the trusted organizations that help that population. That's not new in sort of equity work. You know, people that have established relationships in those communities can be more effective partners in helping to lift people up. Another thing that came up that we hadn't thought about was with the resource centers after the flood. If people are living in their cars, if there's space for them to park nearby, then they have an easier time accessing that aid. Some other recommendations came up for the general population. So, you know, this need to kind of simplify the aid application process and provide clear guidance for people was pretty clear, and all the partners were pretty on board with that, and some of them have been thinking about it for some time. A need to kind of offer help rather than asking people if they need it. So, you know, just by default, if by default you just say, we brought you this help, and then letting that happen instead of saying, do you want us to bring you help? A lot of our partners thought that would help a lot of people receive more help. One of our partners was talking about an area where they're bringing mental health resources around with the organizations that were going door to door right after the flood. So, you know, a lot of these community-based organizations were just knocking on people's doors and saying, do you need help mucking out? Do you need food? What do you need? And so they were, you know, there was one community where mental health providers were with them. And so those community-based organizations that already have the trust and the relationships were sort of making that connection and offering it right off the bat. So that was something that the people on the call were interested in. And then the last comment was just, you know, these community organizations that are responding on the fly and really pivoting, changing their work completely, leveraging a lot of volunteers and just working nonstop in the wake of the flood, are not necessarily getting the financial resources as quickly or as much as they need to be able to do that work. So that was one of the things that we were talking about on the call as well. So those were our kind of first stage findings. We're now thinking about our next steps for continuing to analyze the data and continuing to try to get at the factors that can contribute to that recovery. So I mentioned, you know, we had all these different outcomes. We looked at mobility. Two that kind of stand out on this graph are that unstable income, which actually continued to get worse in the long run. So that's something that we'd like to look at more closely. Not in good health also didn't really recover that much, which corresponded to some of what we're hearing qualitatively. So that's another one we'd like to look at more closely. So far we've done the mobility side. We've looked at the aids and barriers, receipt of aid and barriers. We'd like to evaluate those other outcomes. I'm hoping that we'll have enough data to do some multivariate analysis to try to isolate the factors that are related to recovery. And then we'd also like to look at the sort of differences between larger communities and more dispersed rural areas, because that's something we were hearing about qualitatively from our partners that they perceived was happening. And then we do want to dig more into, we had a whole suite of questions about buyouts that we haven't looked at yet. So that's another next step. I do want to acknowledge the folks on the project. So Sarah led the work and is in Utah now, so I'm presenting for her. Julia, Matt, and Maisie. And then our community advisory committee, I listed a few here. There were actually a total of 20, I think by the end we had more than 40 organizations who had gotten involved and were attending meetings and talking with us about this work. And they provided really valuable help. The few I listed here did a lot of work helping us recruit, so they were particularly helpful. The study participants themselves, and then our funding sources, Gund Institute, and the OVPR, and then in SEMS, we have this Richard Barrett Research Scholars Program that helped us do mobility work. And that's all I have. Let's get questions.
I think it was on the slide with the like gaps in aid. I saw that a couple of them didn't have a long-term section. Yeah, like food and supplies and transportation. So could you just elaborate on that a little bit?
So yeah, good question. Those I meant to fix actually. It's just where the need and the aid received were the same, and I meant to draw a line there.
Yeah, didn't mean to call you out, but
no. Good answer. Yes.
Yeah, I just had a question on the slide with like the map of everyone you got like data from. There's like a little, this one. I'm just curious if you think there is some kind of inequity, like for example, between Montpelier, which I think is probably more urbanized and more city-like than, let's say, if you go up north more. And I was just curious if you think there's like, some kind of like, inequity between the more rural counties like receiving that assistance and aid than versus somewhere like more urbanized.
Yeah, and that's one of the things we really do want to look at. The community partners that we were talking to up in Northeast Kingdom, I think some of them kind of asked that question and said, it feels like people aren't paying as much attention to us up here. And, Montpelier is a bigger town, it's the state's capital. A lot of the organizations that were able to respond were there already. So in some ways it makes sense that you would expect a quicker response there. But yeah, that's one of the things we're shooting at. And then, Montpelier to vary too, just in terms of people's individual resources and the types of community infrastructure in place.
Is that something you think you might be looking into part of your next steps, possibly? Okay.
Good question.
They also received like a lot more media coverage nationally.
Okay, yeah.
So it was even people like in Vermont, maybe knew that they needed more help versus other areas. So
that makes sense.
just getting that information on who to help and how was very targeted to that area.
Yeah. It's interesting.
I have two questions. One's really quick. Are you planning to do data collection on folks who were affected by the July 2024 floods? Just to bolster your samples.
So we've talked about this a couple of times. I think no is my first answer. It's tempting, and we did get people's contact information from this study to say, could we follow up with you? To be honest, I already felt like we were trying to be so careful and respectful of people's time and the effort that it took to talk with us. And I would want to make sure that if we went back, it would be to get a lot more out of it research-wise, out of respect for them. That's part of it. And then part of it is the logistics. Sarah's not here, and it was a big data collection effort.
Yeah. And then my second question is, there are different ways to conceptualize this idea of resilience, where a lot of the times it's like getting people recovered and back to the state that they were in before, versus like when you think about people dealing with repeat disasters, we start to kind of conceptualize resilience through the lens of transformation. I'm curious if that dynamic came up a little bit of like things need to change fundamentally for me to continue to live in a place. Versus like, I'll just keep cleaning up and fixing the things that are broken.
Well, I think that might be where we land when we start to look at the buyouts and the discussion and the questions we had with people about if they wanted to relocate and receive a buyout. And we did have people respond who filled out that part of the survey. We just haven't looked at it yet, but I think that's, I mean, the way Vermont's rivers and towns are located, that we have to be thinking about new futures.
Speaking of buyouts, we got a Zoom question. Can we investigate changes to Vermont law regarding buyouts for businesses and homeowners who are honest with future owners about their vulnerabilities to flood?
It's a good question. Should write that down. I don't have an answer to it. Yeah, I mean, I don't know if we actually would have gotten, we can see in the qualitative data if we got at something where people spoke about that. One thing that did come out just preliminarily with the buyouts, the conversations we had, in some communities, it seemed like the landlords were going for buyouts, which in a way makes sense. If I'm a landlord and I own a dwelling that I'm renting out in order for income, and it's starting to flood periodically, I would just not want to do that anymore if I could get funds. But if I live in that community and I've lived in that home for a long time, it's a totally different proposition. But then the risk is that, well, now if your rental properties are the ones getting the buyouts and we already have a housing problem, where are people going to rent? So that was one thing that we were thinking about too. The other, I mean, and so then when you think about how this is intertwined with housing, the other thing that we were interested in learning more about. So in our previous mobility research, one of the things that comes up for people with limited access to a car is that a lot of the ways that they get around and the way that they get their needs met is through their community connections. So they know people who give them rides, or the person who provides social services is nearby and they have this relationship. And so one thing that I think with the displacement that we're interested in, one thing I'm interested in from that perspective is if someone gets displaced, what happens to those connections and their ability to navigate the system, if they're living an hour and a half away now. Yeah.
2 questions. How did you identify the unhoused population to interview?
So this is a great question. Actually, Julia probably would have, do you have better insights on this than I do? So part of it was, we were working with some organizations that were providing shelter. And so they were providing some connections, and some social service providers where people could show up and receive help. But Julia, do you want to add to that?
Yeah, I think Sarah's also on the call if she has anything to add, but we also got a lot of information from like town centers and people who worked there, who are just very in touch and knowledgeable on the community, and kind of directed us as to where to go find people. So we did some like on the ground work where we like went around to speak to people in person. But I think that and shelters and attending like food pantry type events and other places where there were a lot of resources being provided was like mainly where we recruited people. Sarah.
Yeah. We also asked on the question the type of housing that people were living in.
Housed folks, like, I can only imagine the type of vulnerability status they receive from a research perspective.
In terms of like IRB or
IRB, but also like how do you navigate that? It's interesting.
I mean, I think, and Sarah is on the call. I just saw Sarah. If you want to chime in or send a chat, I think you could weigh in here too. I think in general, our community partners, a couple of them in particular, were pretty emphatic that we needed to be really careful how we talk to people about what had happened because of the trauma involved. So we had already kind of tried to go through the protocol and think about those things and do things like provide cash on the spot instead of a gift card after the fact, things like that to make it more helpful to someone who's just like needs assistance in that moment. I think beyond that, I don't think we took any additional precautions beyond that.
Mm-hmm. I mean, in the last study that Dana was mentioning, we've had experience working with vulnerable populations, and just making sure we create kind of like a safe or respectful environment when asking those questions. So I think we try to accommodate to wherever people or however people felt the most comfortable answering, and the unhoused was mostly all in person. So those were in spaces where like they felt comfortable, and they were usually surrounded by people from their community. I mean, not directly there, but there's privacy, but.
Sarah said that they asked people the type of housing they lived into. That's what she told me.
There was a woman that was here 2 seminars before and posed a really interesting question around the FEMA buyout, around sort of local governments prohibiting people to do the buyout because the grand list. That was, when she asked the question, that was all new to me, and so I'm just regurgitating it, not having looked into it myself, but I feel like it's very relevant here, and I was curious if for any of your long-term respondents, if they mentioned any of that issue.
I don't know offhand if our respondents did, but I know that it came up with some of the town managers we spoke with, because part of the process of getting the buyout is that it has to go through the town's process, was my understanding. So, I mean, I think that's right, that you can't just request a buyout if the town isn't on board.
Because they assume ownership.
Because they assume ownership of the property, and then, but then it also, you know, brings up what the town thinks is the best path forward. I didn't speak with any town managers who said, you know, our town is against this. That doesn't mean that that's not. Julia, do you know if that came up at all in any of the conversations?
I know there were people who were definitely against it. There was like some sentiment of kind of the government taking advantage of people like at a time of need. That came up a lot.
So this is, I mean, this is definitely one that that is one of our next steps to look more closely.
That is, yeah.
It definitely shook me because the property taxes are what pays teachers, so it it's a system problem, and not a town manager is just arbitrarily saying no. It's just like they're in a system where they're restricted. So,
well, and when you think about, you know, so from a transportation perspective, I'm always thinking about what's happening in the small town center, and that, like in our other research, that we find that for sustainability and for having your needs met, having access to a small town center and being near it is really helpful, and it helps you have more options and helps you reach more services. And so the idea that now we have to think about how to empty our town centers in some cases, not empty, but like really reduce what's there, it feels difficult if we can't figure out a way to keep any new development there to take its place.
Can it shift?
And
town center, instead of taking it away, what about just shifting it?
Yeah. I mean, can we build new
new
things that are still in the center, but not in floodplain? Yeah, I mean, that would be ideal, I think, if there's, but you know, and I'm not an expert on the housing troubles in Vermont, but I think it's not simple.
No.
So anytime you're taking away, you know, a few, like the store in a small town, or, you know, the apartment units in a small town, it's hard to, you know, usually then proactively replace.